1 in 10 people aged 65 and older in the United States have Alzheimer's. Alzheimer's is the 6th leading cause of death in the United States, and it's the only in the top 10 that has no cure and no survivors. Every 65 seconds, someone is diagnosed with Alzheimer's. In 2013, a community health assessment was done by the hospital and by the health department. It was determined then that there were not enough services on the Outer Banks for those with dementia and their caregivers. Hence, the Dementia Task Force was formed. Dementia Task Force is made up of 12 volunteers, and they're community folks. We have folks from Department of Social Services, from the police department, from Sheriff's Office. We've partnered with other organizations and community businesses to provide the resources and services to the Outer Banks.
I'm Jan Collins, and I am a member of the Dementia Task Force as a result of having cared for my mother for 8 years who had Alzheimer's disease. The Dementia Task Force was formed to be helping hands to caregivers, and by that we mean we are there to assist loved ones caring for people with dementia in many different avenues. One is with support, and the other is to also provide assistance with respite care, and also to do seminars so that they can go to and hear from other people, other professionals on the care of loved ones. The goal of the Dementia Task Force was to get the hospital involved in becoming the first dementia-friendly hospital in all of North Carolina. And then secondly, we're trying to get the restaurants to become dementia-friendly, and we now have 10 restaurants that are dementia-friendly. Our goal is to reach the businesses, especially the pharmacies and the grocery stores. And then if we do this, the community will become maybe one of the first dementia-friendly communities in all of North Carolina.
We've been on a journey to become dementia-friendly. And what dementia-friendly means is that we've taken a different approach to a patient that has a cognitive disorder. And part of that journey was educating all of the staff, and that includes every person that the patient would come in contact with, from registration to your dietary staff. Any person that would have contact with this patient would be aware of what a cognitive disorder patient would be. We also found out, how do we tell our staff that this is a cognitive disorder patient, a dementia patient? So we used a seahorse. And the seahorse symbol comes from the hippocampus in the brain, which is the part of your brain that has that memory storage. And then purple is your color for Alzheimer's. So the Dementia Task Force of Dare County came up with that symbol. And then we brought it here to the hospital, and we put it on the patient doors, we put it on the patient charts, and just that visual cue can tell any person in the hospital, because now they've all been educated, to approach that patient a little bit differently.
We need to get more people involved. We need to have people that understand dementia, and we want to give those resources out to people, but we need people to know we're there, and they need to know what our services and what resources we have available, how we can help them.
What you are doing with this organization is you are bringing the realization to people that they do matter, that it's okay to be with that person with dementia, and in fact, you should seek that person out, because they still are who they are, even though their brain or their conversation wouldn't be the same.
This has always been one of my passions. I know people talk about passions, but in 1990 I started working in an assisted living community and have worked in one for the last almost 30 years now. And 5 years after that, my dad was diagnosed with Alzheimer's. It's funny how you get put in a certain place so that you can help those that need help. And that's what's important. I've been with many folks in the hospital or in situations where they needed that assistance, they needed that one-on-one attention. And all you have to do is give them a hug and a smile and sing with them, and you've made their day.
Dementia and cognitive disorders are affecting and will affect every person. You will either live with someone, be a caregiver for someone, work with someone, interact with someone that has cognitive disorders. We must respond to it as a community, as a person, and as a hospital. It's going to happen. It is happening. It's a growing population. It has to be addressed.